Vaginal tightening or spasm can happen to any lady depending on so many factors that can facilitate or precipitate this. This is medically called vaginismus. Vaginismus is a condition where there is an involuntary tightening or spasm of the vaginal muscles, causing penetration or painful or even sexual intercourse impossible. This can happen to any lady, this can happen to any woman at all. It's not age limited. Provided you are in your reproductive age, it can happen to any woman at all. Most often, this tightening is not something you can control. This tightening is not something you can voluntarily say, okay, I want to stop tightening my vagina. I want to stop it from, getting too tight. I want to stop this spasm that is happening. Most often, it's autonomic and it's mostly controlled in the central nervous system. You do not have that voluntary or controlling power over the muscles of the vagina. So it is automatic. So it is a reflex action. It's not something you can say, "Hmm, I want to control it." No, sometimes it's just happen on its own. So what exactly can cause this vaginismus, this tightening of the vagina? Some of them include anxiety or fear. For someone who had had a rough ride, a bad sexual experience, there is tendency that she is going to experience this vaginismus during sexual intercourse because the fear of passing through what she had passed through earlier, if she's not psychologically healed, if she does not undergo healing, she may be experiencing vaginismus anytime she wants to go into sexual act or sexual intercourse because the images are still vivid in her mind. So this fear grips her, this fear is always there. The fear of, am I going to experience what I experienced before? Is it the same pain? Is it the same type of penetration? Is it the same type of question of forcefulness I went through? So these things, these past sexual experiences allows fear to grip the individual, and involuntarily the muscles of the vagina begins to tighten, not allowing that penetration to happen because she's not relaxing the mind. The mind is not so relaxed. The mind is filled with fear and anxiety. So this can cause vaginismus to happen to a girl or to a lady. And another is emotional factors. This is not about anxiety. This has to do with emotional stress. Is she having relationship issues with the person she's currently having that sexual intercourse with? Are you having any problem? Is there any psychological stress? Is there any emotional trauma? Is there something like emotional blackmail? Something that has to do with her emotions. If she's not relaxed emotionally, if she's having emotional issues, emotional troubles, there is possibility that she will not be comfortable having that sex. She will not be comfortable having that sexual intercourse. So there will be tension around that vagina. There will be tension around the vaginal muscles. And once there is tension around the vaginal muscles, they can't relax. They go into tension, they go into spasm, they go into tightening. And this is what is called vaginismus. They'll be tightening because there is a problem somewhere. So for you to have a very good sexual experience, you need to be emotionally stable. You need to remove that stress, the emotional stress, that work stress from your mind so that your body, your muscles can relax and enjoy the pleasure for the moment. Can also be medical conditions like infections, sexually transmitted infections, UTIs, hormonal imbalances, and even menopause. Yes, menopause. During menopause, the lubrication of the vagina is reduced. So there is no free penetration. There is no the pleasure of that lubrication is not there. Most often you'll be advised to use water-based lubricants, to make the sexual activity fun and pleasurable, something like that. So when you are going into menopause, when menopausal symptoms are coming up, you may likely start experiencing vaginismus because the muscles cannot relax the way they used to be earlier. There is tension already. There is kind of dryness around the muscles. So the muscles begins to tighten. There is atrophy of the muscles. Okay, there is atrophy of the muscles. So there is tightening of the vaginal wall. There is tightening of the vaginal muscles. So it can also lead to vaginismus. And I mentioned infections earlier. Yes, infections can also lead to that, and hormonal imbalance. The hormones that will help the vaginal muscles to relax may be deficient or may be in a low quantity. So this can also impact on the relaxation of the vaginal muscles. And if they are not well relaxed, again, they go into tension and spasm, causing vaginismus. And there are some cultural or religious teachings that makes one feel bad having sex, that makes one feel I'm married, I should not be having sex. If not during the time when my husband and I we want to conceive, we should not have sexual intercourse. Some of these teachings, some of these cultural practices makes the lady not comfortable having sexual intercourse aside the time planning for conception or fertilization. So when these teachings are imbibed, when these teachings are internalized by the woman or by the girl child, she becomes so fearful, she becomes so guilty of having sexual intercourse. There is this guilt that comes in her whenever she wants to have sexual intercourse with her partner or with her husband. With the belief that she's doing the wrong thing, she's not going according to her belief. So that sexual intercourse is not concerned with childbearing, her belief says she should not have sexual intercourse because it's basically for childbearing and not for fun. So with such guilt, she will also not she won't be relaxed having sexual intercourse. So if you belong to this category, please and please, if your wife belongs to this category, please, you guys should talk it out. Sexual intercourse are meant for couples. They're meant for people who are married. They should enjoy themselves having fun. So if you belong to this category, sexual intercourse is not just for fertilization alone. It's not just for childbearing. It also enhances companionship. It enhances that relationship. It helps to foster relationship between husband and man. So if you belong to the category that says aside fertilization, there is nothing else that concerns us with sexual intercourse, no, please expunge such ideology, throw it to the bin. It is not it is not wise for couples. All right. So you got to enjoy your husband, your wife when you are married. Okay? What are the signs and symptoms that actually depicts a woman having vaginismus? One is painful penetration, like painful penetration. Ideally, sexual intercourse should be fun. It should be pleasurable. It's not something that should cause pain, right? So when you begin to have that consistent pain, you may have to check, is my vaginal muscles tightening? Is there tension around that area? Once there is painful penetration, it's a consistent thing, it's a regular thing. Once you're having intercourse with your husband, you notice there is this intense pain with you, you may need to check yourself to ensure that you are not having that vagina tightening. You may ask your husband to help you do that during sexual intercourse, okay? There is also inability to insert tampon. For those of us that use tampon, you may experience inability to even insert a tampon, and during gynecological examination, there will be difficulty of that because once there is something going in, the muscle on its own, they just click. Something is coming up and they begin to tighten. So there is this pain also in inserting tampon in gynecological examination. And most often, there is this sign of avoidance of sexual intercourse. Once your husband comes, because you've already experienced the pain, and once he starts any sexual act, you feel this fear, the anxiety just comes up, and you do not just know how it comes, but it's just there because the fear of the pain you've experienced before is still there, and you don't want to experience that pain again. So there is this pain that comes with you not having anything to do with sex. There is this anxiety that comes with it. So when you experience these things, you may need to seek for help. Okay, you may need to seek for help to get rid of this vaginismus. So the help or the treatment or the management ranges from sexual education. Proper sexual education goes a long way to combat this. For example, these cultural beliefs or teachings that teaches couples that they only have sex when there is a need for a child. Such teachings need to be debunked and demystified. Okay, and your healthcare provider can encourage you to do pelvic floor therapy, yes, through the guidance of a physiotherapist. So you may need a physiotherapist to guide you through pelvic floor exercise in case this vaginismus have to do with the physiological functioning of the vaginal muscles, so that these exercises can help your pelvic muscles to relax. Yes, it can help your pelvic muscles to relax very well. And then psychotherapy. This is very important. If you've had bad sexual experiences, you are not alone. You are not You are not just there alone. Don't wallow in self pity. Don't wallow in pain. Speak up. Seek for help. Go for those sessions. Don't miss your therapy. Go for those sections and talk it out. At the end, you will see how far you've gone. You will thank yourself for actually seeking this help. Okay. And in some cases where it has to do with an underlying medical conditions, please go see your doctor, go see your healthcare provider to get these things treated. Because for the fact they keep enduring in your body, vaginismus we also keep enduring. Yeah, vaginismus will endure. So get yourself treated of any sexually transmitted diseases. Get yourself treated of hormonal imbalances. Get yourself treated of infections so you enjoy a pleasurable sex. So yes, vaginismus is treatable, it is manageable, but first you have to seek what? Help. All right? You have to seek help. And please, if you're a husband to a woman who is experiencing this vaginismus, please be her emotional booster. Help her go through this phase till she is quite fine. She is comfortable. She sees sex as something that is pleasurable, something that is fun to have. Help her go through this phase till she is balanced and you both enjoy yourselves. All right? So please be her emotional booster, be her shoulders for her to lean on. Okay? You do not have to, casual or talk down on her. Please be her, boost her self esteem. Let her not feel bad that she's no woman enough. She's not able to satisfy her husband. She's not able to do this. She's not able to perform. All those talks. Please be her emotional booster. Together, both of you can combat vaginismus. I hope you've learned something today. I hope you got value watching this video. And until next time, bye.